KappaMab is a monoclonal antibody developed by HaemaLogiX to treat blood cancers, with an initial focus on multiple myeloma. KappaMab recognizes a receptor called Kappa Myeloma Antigen, or KMA, on the surface of malignant plasma cells in approximately 70% of myeloma patients. These patients have Kappa-type multiple myeloma. KappaMab binds to KMA, inducing the recruitment of natural killer cells, an immune cell in the human body that attaches to the antibody and destroys the malignant plasma cell. This process is called antibody-dependent cell-mediated cytotoxicity. The binding of KappaMab to KMA also activates the human body's other natural immune cells, called macrophages, that will engulf and destroy the cancer cell through a process called phagocytosis. Because KMA is only found on malignant plasma cells and not on normal cells, KappaMab will leave normal blood cells safe and unharmed. Multiple myeloma is a cancer of the plasma cells, which is a type of white blood cell found in the bone marrow. Multiple myeloma is called such because there are multiple patches or areas in the bone marrow where the malignant plasma cells grow. Clinical studies have shown that KappaMab works synergistically with the immune modulator drugs that are standard of care for treatment of multiple myeloma. Because the immune modulator drugs used to treat multiple myeloma, such as Revlimid and Pomalyst, increase the number of KMA receptors on the surface of malignant plasma cells, they create more sites for KappaMab to bind, thus recruiting more natural killer cells for cytotoxicity and activating more macrophages for phagocytosis. HaemaLogiX is developing KappaMab into other platforms, such as a chimeric antigen T-cell receptor, CAR-T therapy, and bispecific monoclonal antibodies, bringing additional treatment options that will benefit patients who have not responded adequately, those who have experienced serious adverse events, or are frail and cannot tolerate the existing therapies. HaemaLogiX is also developing a monoclonal antibody called LambdaMab to target Lambda Myeloma Antigen, or LMA, which is found in approximately 30% of myeloma patients.